Houston history. Our health reporter Haley Hernandez is here with us to talk about what's so significant about May 3rd. Good morning.
Well, May 3rd, 1968 is when Dr. Denton Cooley made medical history performing the first successful transplant of a human heart. Now, that is really what put Houston on the map as a hub of medical innovation. You know, before that, we were an oil and gas town. Right. Now we're a medical city. Today is the 55th anniversary of that transplant, and I wanted to show you a little Houston treasure. We have video. On the first floor of the Texas Heart Institute, there's a museum. Okay. And this is really dedicated to Dr. Cooley's work. Now, I encourage a lot of people who come into town and don't know about the medical center to really take a look in there. You know, people who come to these hospitals and they're waiting a long time in lobbies, and it's right across the street from MD Anderson. So I say, take a walk over there. You'll really learn a lot about the medical center and just Houston's history in general. So it was actually that was actually the first tour I got as a health reporter. The Texas Heart Institute invited me in, so that's how I even know that it's there. It does hold artifacts that contributed to the first transplant. Dr. Cooley was a medical pioneer. He died in 2016 in his 90s, but yesterday we spoke with the CEO of Texas Heart about how significant this is to Houston history.
But Dr. Cooley is largely recognized for being the first surgeon who actually performed the operation and got the patient out of the hospital. That patient had come here because he'd had an infection that had affected a number of his heart valves. And Dr. Cooley, when he identified a donor, decided that he was going to go open up the heart, and if he thought that he could repair the valves, he would do that and not transplant the patient. But when he looked at how badly diseased those valves were and how deteriorated the heart was, he knew that he wouldn't be able to replace the valves successfully. And that's when they performed that first heart transplant. So there was a series of transplants that occurred after that. He actually had probably the biggest series of transplant patients within about the first 4 or 5 months. But at that time, we didn't have the kinds of medicines that we use today to lower the immune system. And so the problem for these patients was that they would have rejection of the heart, and then they would succumb. And transplantation didn't take off until the early 1980s when cyclosporin was developed. That's the drug that we use to lower the immune system and prevent rejection. And now transplantation has become a relatively common procedure that's performed across the world.
So really, this is what started a legacy in Houston that still makes us today a worldwide medical destination. Without that medication, that first patient lived less than a year, but at that time, that was really considered amazing. That was considered a success. And we have someone in our newsroom who was also impacted by Dr. Cooley's great work. I'm going to talk to her coming up at 8 o'clock. But also, as a reminder, my dad has now lived a year and 2 months with a kidney transplant thanks to medication and innovations like this. This really propelled a lot of the transplant success that we see today.
It's just incredible.
Absolutely.
The strides that we've made in this city, and how many families are really grateful for all that work.
Yeah, how many families are impacted even just by Dr. Cooley's patients, even though he's not around anymore. Right. I mean, he left such a legacy for our community that still a lot of people in our community are impacted by what he did.